What would you think if I tell you there is a cancer that is almost completely curable when caught early? Hello, I'm Dr. Daniel Serralta, Colorectal Surgeon at Dubai, and today I am going to reveal the subtle warning signs of colon cancer that too many people miss until it's too late. The statistics are shocking. When detected early, colon cancer has more than 90% survival rate, but once it spreads, that drops gradually. And here's what's truly alarming. The National Cancer Institute now reports colorectal cancer as the leading cause of cancer death in people aged 20 to 50. This isn't just medical information. This video could save your life or someone you love. So please, watch until the end and share this with those you care about. Before we discuss the warning signs, let's understand what colorectal cancer actually is. It begins in the large intestine, in the colon or in the rectum, which is the last part of the digestive tract. Most colorectal cancers start as beginning growths called polyps. Over time, some of these polyps can become cancerous. The good news is that during routine screening procedures like colonoscopies, these polyps can be removed before they develop into cancer. Early warning signs. 1. Changes in bowel habits. If you notice you are suddenly experiencing constipation, frequent loose stool, or diarrhea that lasts longer than a few weeks, it's worth investigating. Why does this happen? The colon is responsible for absorbing the water and forming the stool. When a tumor develops, it can disrupt its normal function. A growth in the colon can irritate the bowel lining, increasing water secretion and speeding up transit time, resulting in diarrhea. Alternatively, if the tumor creates a physical blockage, it can slow down or prevent stool passage, causing constipation. Could indicate that a growth is intermittently obstructing your colon. 2. Unexplained weight loss. In my practice, I've seen many patients who first notice unexplained weight loss before receiving the diagnosis because the cancer cells release substances called cytokines that essentially hijack your body's metabolism, diverting nutrients to support the tumor's growth instead of your body needs. If you are losing weight without changes to your diet or exercise routine, this deserves medical attention. While it could be due to many conditions, unexplained weight loss should always prompt thorough evaluation. 3. Blood in the stool. This is perhaps the most recognized sign of colorectal cancer, yet many people dismiss it. The blood may appear bright red on toilet paper, in the toilet bowl, or mixed with your stool. Sometimes it may be just tiny amounts, barely noticeable. I cannot stress this enough. If you notice blood, regardless of how minor it seems, please consult a healthcare professional. Assuming it's just hemorrhoids without proper evaluation can lead to devastating delays in the diagnosis. 4. Dark or black stools. While bright red blood usually indicates bleeding in the lower digestive tract, dark or black stools, also called melena, typically suggests bleeding higher up in the digestive system, which is the stomach or small intestine. As blood travels through the digestive tract, it interacts with digestive enzymes, turning from red to black. However, bleeding from the ascending colon, located on the right side of your abdomen, can also cause dark stools. That's why any unexplained change in stool color, particularly to black, warrants investigation. 5. Iron deficiency anemia. This is subtle yet critical sign, especially in men or postmenopausal women. Colorectal tumors may cause chronic low-grade bleeding that isn't always visible to the naked eye. Over time, this slow blood loss depletes the body's iron reserves, eventually leading to anemia. The symptoms of anemia, which are fatigue, weakness, painless, shortness of breath, while there are many causes of iron deficiency anemia in adult men and postmenopausal women, colorectal cancer must always be ruled out. 6. Feeling of incomplete evacuation. Many patients describe a persistent feeling that they haven't completely emptied their bowels, even after a bowel movement. The medical term of this is tenesmus. This sensation occurs because tumors, especially those in the lower colon or rectum, can press against the bowel wall or mimic the presence of remaining stool in rectum. This symptom is frequently misattributed to irritable bowel syndrome, but it persists for several weeks. It requires proper evaluation. 7. Excessive gas and bloating. While everyone experiences gas and bloating occasionally, persistent symptoms without a clear cause, like dietary changes, could signal something more serious. A growing tumor can cause partial blockage in the colon, trapping gas behind it and leading to uncomfortable bloating. Additionally, tumors can disrupt the normal digestive process and alter your gut microbiome balance, resulting in increased gas production. When the passage of waste slows due to partial obstruction, bacteria have more time to ferment and digest the food, producing even more gas. If this symptom persists for more than a few weeks without explanation, it's important to seek medical advice. The most common early sign is no symptoms at all. By the time symptoms appear, the cancer may already be advancing. This silent progression is the reason why screening is absolutely crucial. The goal is to detect polyps or early cancers before symptoms develop, when treatment is less invasive. Screening recommendations. For those with a family history, in general rule is to begin screening at age 40 or 10 years before the age your relative was diagnosed, whichever comes first. And what are the screening options? Although the gold standard for screening is colonoscopy, which allows to examine the entire colon and remove any suspicious polyps during the same procedure, it is uncomfortable, expensive, and have potential complications. That's why in many Western countries, like my own country, Spain, the first-line screening is done with a simple stool test, which is cheap and allows to select those cases who should actually undergo colonoscopy. This test should be repeated every year, and only if positive, you will continue, allowing a reduction in the total number of colonoscopies that is done and making it affordable in a population basis, but also comfortable for the patient. Now, as we wrap up, I want to emphasize that colorectal cancer, when caught early, has excellent survival rates. The rising incidence in younger populations makes awareness of these warning signs more important than ever. Don't ignore persistent changes in bowel habits, unexplained weight loss, blood in your stool, or new and persistent abdominal discomfort. These symptoms may have benign causes, but they deserve proper evaluation. I encourage you all to have open conversations with your healthcare providers about your risk factors and appropriate screening schedule. Thank you for your attention to this important topic. I'm Dr. Daniel Serralta, and I am committed to fighting colorectal cancer. Remember to like this video and share it with anyone who might benefit from this information. Your share could literally save a life.